Hi, Dr. Scott Jensen. I want to say a couple things in this brief video. First, flawed PCR testing has real consequences which can be very harmful to real patients. And second, why would we not do more antibody testing to confirm whether or not a positive PCR test really appears to be positive? Clinical correlation with symptoms and a patient's story is important. The first situation is a colleague I talked to about 48 hours ago who went into the emergency room, had positive antibodies previously from the Red Cross blood bank. He had had PCR a couple of months ago, donated blood later. The blood bank confirmed his antibodies to COVID-19, and yet when he went into the hospital, a standard PCR test done in the emergency room was positive and dissuaded the surgeons and the doctors from doing the immediate surgery, so that when he did have surgery for his ruptured appendix, he ended up having to have a drain put in, and something that could have been potentially much quicker and easier to get over is now going to be weeks or months with a drain in place. The second patient that I saw, or the second instance I want to describe, is a patient I saw a couple days ago who'd had a stroke. She'd been fully vaccinated, and the vaccination series had been completed 4 weeks earlier. She had a stroke, left side of the brain, causing right-sided weakness, and she was, because she had a routine positive PCR test in the emergency room, declared to have COVID. She had no symptoms whatsoever. She had been fully vaccinated 4 weeks earlier with the second of 2 Moderna shots. What happened? She was admitted to the hospital, quarantined, and when she was discharged, she wasn't able to go to physical therapy. She had to wait until her quarantine was over. But they were willing to send out someone who was dressed in what looked like a hazmat suit. This kind of physical therapy for someone trying to recover their strength is far less than ideal. In both of these situations, a positive PCR test was probably flawed. One situation was a colleague who had positive antibodies confirmed by a blood bank. The other situation was a patient of mine who I spoke directly with and examined 2 days ago who had been fully vaccinated. In both of these situations, the hospital chose to not confirm or deny the PCR accuracy with antibodies. I went ahead and did antibody testing on my patient with the stroke, and she had both positive IgG spike protein antibodies as well as antibodies to the nucleocapsid. We need to be more ready to utilize antibody testing to confirm or deny a flawed PCR test. Please think about it. Doctors, we can be a little bit more aggressive and allow our intellectual curiosity to confirm or deny the value of a PCR test, which we know is fraught with many false positives. Thank you.